This is Mocha Vets. I am Dr. Morris with the Botanical Vet.
And I'm Dr. Armstrong, the Modern Vet. And we are trying a thing this year. And so for 2022, we wanted to
increase the communication between pet owners and their veterinarians. We want to dispel a few rumors and clear the air about general husbandry with animals, common education, tips, tricks, general information for the public.
And we also want to make it fun again for you guys owning pets, whether it's a pandemic babies or before, or even, you're interested in getting a pet now. We want to make it fun for you guys.
Rolling into this is our first meeting, our first video. We will be talking about the 5 ways in which modern pet owners can learn how to save money.
That's right. So jumping right into it, the first tip that we have, or the first way you can save some money, is by getting insurance. We know you've heard it time and time again, but seriously, it makes a big, big difference.
Some of these companies will literally pay up to 80-90% of your vet bill. Will include holistic alternative medicines, chiropractic, acupuncture, surgeries, medication, anything that your vet will prescribe. That's not over the counter.
Exactly. And it's better to get any kind of help that you can, especially when you have to deal with emergencies. It's never something that we expect to happen, but we really should expect it to happen. And your emergency visits are not going to be $300 all the time. Like, we're talking thousands of dollars sometimes. So any kind of help is better than no help. Even if you have to pay out of pocket initially, which is something we'll get into, at least you know that you're going to get that money back for the most part.
Exactly. And then the biggest tip would be get it while they're young and healthy before the problems creep on up. When you have that nice bill of health, right? It says healthy pet. That's when you should get it.
Exactly.
Be mindful though that depending on what type of breed you have, they might be more predisposed to certain disease processes later on in life. And some pet insurances know this and may charge for that.
Exactly. So for example, labs are known for having their ACLs getting torn at some point in their life. Like, it is just a thing. And majority of the time you are going to need to have surgery done. So before it becomes a problem, before surgical intervention is necessary, just get that insurance. So that way it's not considered pre-existing condition. Because I can't tell you how many times I've heard pet parents say to me, "I'm just going to get insurance now." And it's like, don't. It's too late.
It's going to cost too much money at this point.
Exactly.
Like, you will spend your money. Yeah.
No. So, and they know how to read the records. And of course, we as doctors, we have to write the records accurately. So we're never going to write the records to hide anything from the pet insurance. That's never going to happen. So That's why it's in your best interest to get the insurance before we detect that busted up knee. Yes. Oh, the next thing was putting money aside, and you were saying like $5,000.
$5,000 is a decent amount. I mean, if you think about 15 years for large breed dogs, up to 20 years plus for cats.
Right.
$5,000 is not that amount. You consider their food. I mean, anything could happen. Hit by cars, it could run out, pregnancy could pop up, anything.
Yeah, so it's better to have the little stash put away for them, because just like with us as humans, anything can happen no matter how diligent we are with our health. So it's better to have something set aside and feel rest assured that, okay, I can afford that. You know what I mean? So now, of course, there are options like care credit and scratch pay, but just have something tangible, have something ready.
Yeah, definitely.
Now, some basic costs that you have to keep in mind whenever you have a pet. Basic costs include vaccinations, so your wellness visits. It's no different from you going to your doctor, getting your checkups, or if you have a kid, you taking your kid to the doctor and getting checkups. The biggest difference is we have the insurance cards.
Exactly. And then I know we're kind of aware of the vaccines, but also understand if you want your dog to participate in like doggy daycare, boarding, getting groomed, they're gonna ask for the current up-to-date vaccines.
Exactly.
So definitely make sure you're staying on top of that.
Yep. And I would say some other basic costs to keep in mind are training. Like not everyone can train, and not everybody has a badass dog running around. Okay. It's not cute. Just like you don't want your kids to be little ragamuffins. Like bad pets are not okay. All right. So,
yes, you should not be scared of your dog. Okay.
Nope.
If you're scared, I'm scared.
Exactly. I'm scared and I'm judging you.
So let's just practice some sit, stay.
Exactly. Yep.
Just common things here and there that can at least help maintain, I guess, the boundaries between you and your pet. Now, cats are different. Okay, we'll talk about them later. But yeah, they're a little different.
Right, absolutely.
Another way in which you can save some money: nail trims, pedicures, clipping the nails. You can do this by yourself. You do not have to come into a vet and pay $12, $16, $20.
Especially if it's on ER. Don't get me started.
Yes. This does add up. Your pets are going to need this, you know, sometimes throughout their life if they're not wearing it down on their own. And it's a good way for you to teach your dog and cats some boundaries. So if you know that you're scared of cutting your dog's nail because they're going to bite you in the face, you're going to get charged a little bit extra for aggression.
Exactly.
To come in and have me do that.
Right.
And it's just something that you should be able to do as a pet owner, along with being able to brush their teeth every day, daily.
Yeah.
That can also help in the training process of your pet.
Absolutely. Another reason why it's so important that you keep your dog's nails trimmed, or even your cat's nails, because for dogs, they can get torn toenails. That means blood everywhere and pain and a trip to the ER. So it could have been free, meaning you cutting your own, you know, their own nails, or maybe, you know, keeping it up with the groomer or whatever, is now going to turn to a couple $100s. Because depending on how torn it is, we're probably gonna have to sedate more than likely, bandage, medications, right? So that is that's preventable. That's preventable. And as far as the teeth are concerned, if they got a jacked up mouth, they have a tooth root abscess. That's a visit to the vet, ER, probably surgery to get it removed, x-rays, things like that. So why go through all that when you can, you know, do the whole prevention is better than cure thing?
Exactly. The other thing with the nails is that a common thing I've seen come in is, oh, we have a pet that's limping, we don't know what's going on, broken, you know, leg, what's going on? Come to find out, it's an ingrown nail.
Ingrown, oh my goodness.
All the way into the paw pad. What do? Clip it down, clean it, scrub it, send you some pain meds, a little anti-inflammatory, and we're done. But that office visit, those meds, my technician needed to hold.
Sometimes sedation.
Not all. Yes, sedation, because it's painful. It's painful. All of that could have been avoided.
Right. Yeah.
And then just touching on the teeth.
Oh yeah.
If you have a small dog, brush them every day from the puppy, honestly, because they are pre-exposed to terrible dental disease, periodontal disease. I mean, dental bridging calculus, terrible breath. Like you say, you could have an abscess, drainage, discharge, pain, you know, inappetence, no longer wanting to eat.
Right.
I mean, would you rather you brush every day or come in, spend about $500 to $1,000 for a dental cleaning?
Right. And here's the interesting thing. So you work primarily in general practice, right? So you see these regularly. I work primarily in the ER. So whenever I see these, it's going to be a little bit different from whenever Dr. Morris sees them, because sometimes pet owners will have no idea why their pet is ill. Meanwhile, it's the mouth.
Yeah.
Meanwhile, it's something that they could have been going to Dr. Morris for. Yet here they are with me. They spent money on sprays, they spent money on blood work, only to find out it's the rotten mouth. And that's why they don't want to eat, because they're so painful.
Exactly.
That's almost $1,000 only to find out it's a mouth. Could cost you an office visit and a toothbrush.
Literally. And honestly, dentals are beneficial. I do like this. If you're aggressive dog, she's not gonna let you brush your teeth, which it happens. I get it.
Right.
But typically it's done maybe once, maybe twice a year if you can afford that. But ideally, daily brushing is gonna be your best friend.
Mm-hmm. No different from my mouth. No different from my mouth, no different from your mouth.
Exactly.
I don't want to know what it's like going a whole year without brushing my teeth. You know what I'm saying? So why did you do it to animals? Like,
yes.
Oh
yeah, exactly. Mm-hmm. Exactly.
So I was just going to say the other thing that's really important is whenever you are trimming the nails and playing in their mouths and doing all the things, like consider that your own exam, right? And it's really no different from women doing their breast exams in the shower, early detection, or men, you know, when you're showering and you down there, you know what I mean? Testicular cancer, what have you, but early detection. So your doctor's not in the shower with you, but you have your hands and you pick up on things that you might think are abnormal. You go to the doctor and the doctor confirms. So
exactly. Understanding that the veterinarian client-patient relationship is so important because you're there with your pet every day. You know, you're going to see more than what I can see. You're going to know those small differences, the things that occur here and there. So yes, get hands-on, get in there, you know, really feel armpits, crevices between toes, paw pads, all the things. When you come into the vet, you're like, these things just popped up. Location here.
Exactly.
Show me, physically point them out because sometimes you're like, oh, left shoulder, right shoulder.
And it helps us out. It helps us out because that way it cuts back on testing that needs to be done, right? If we have more information from you, it cuts back on testing that needs to be done. It cuts back on the number of visits, right? If we can localize the issue right then and there. Exactly.
And then that touching hands-on leads into the bathing. Shampooing. I know with the corona it's been a tough year. We've seen lots of matted dogs, you know, having been bathed and, you know.
Yeah. I'm sorry, pet owners, but I'm tired of seeing dusty dogs. There's no reason. It's just shampoo and water. Like, we're not asking for you to detangle. Okay. I just don't want to see the dust in my face when I'm in the dog. Like, come on.
Oh, wow. Okay.
You know, like, where do they live in the basement? Like, what's up?
Love on.
Exactly. Oh my gosh.
Yeah, and that's like general first aid, right? So it's like see a lot of dogs for skin things. And the first question I ask is, how often do you bathe?
Yeah.
Bathe what? The dog?
Bathe what? Exactly. You don't have to.
How often do you clean the skin, get rid of all the debris, the dirt, the dead hair that could be harboring bacteria that could cause a superficial skin infection? You need to clean it.
Yes. Because again, would you go a whole year without bathing? Don't answer. So.
Yes.
So the third way that you can save some money is by knowing the breed that you're getting. Now, we know that adopting animals has been the thing lately. I respect it. I get it. So most of the times the animals in the shelter are going to be mixed breed dogs, right? So we may not really know what we're getting, but if you know what you're getting, if you're getting a purebred dog, know the characteristics of that breed, know the health issues, the common health issues associated with that breed.
Yes, common example, brachycephalic. So these are dogs with the no nose. You know, you got the long nose, medium nose, and then you got the smush face right into the wall.
Yep.
So Frenchies, bulldogs, boxers. A lot of the time, they might have the brachycephalic airway syndrome. So if you look at their nose and you can't get your pinky finger in there,
right,
they might have some issues breathing as they get older in life, or if they get overweight, they might have issues there. Other genetic things could be elongated soft palate, so that increased snoring could occur. They could have extra musculature in their throat, so that could be causing some occlusion. They could have genetic things like a smaller size trachea that we generally cannot fix. So understanding these issues and potential surgeries that you might need down the road is helpful.
Right. And the other thing too is, talking about the brachycephalic breeds, knowing what the limit is with your dog. So if you have a Frenchie or if you have a Bulldog, know their limits, because I can tell you how many times I've seen, dogs come in blue, purple, struggling to breathe. Summertime, they're out there playing fetch for 5 hours. Like, for what? You know what I mean? So if you understood the limitations of your dog, then you would know 5-10 minutes, maybe 15 max. The moment I start seeing or hearing the increased sounds, time out. You know what I mean? We're done. And that's it.
No high heat, none of that.
Otherwise, it's going to more than likely end up as a euthanasia.
Unfortunately, because their body just cannot handle that. Especially when you have other confounding factors in conjunction with that. So if your dog has high anxiety and the cephalic, these are not two good things to have, because in a situation where you might need to go to a doctor, they might get so anxious that they work themselves up to the point where they might pass out.
Exactly.
They might faint.
Exactly.
And understanding that, they already have issues with constraints, so we cannot restrain them like we do a normal dog, just because we don't want to make it more difficult for them to breathe.
Right.
We don't want to cause further stress. And understand that these typically purebred dogs are $3,000-$5,000. You need to have at least that much set aside for your just in case I need a nose job, surgery.
Yes.
That might come out.
Absolutely. I would say another breed too, going back to the labs, they are notorious for eating everything in sight. Majority of the foreign body cases that I come across are labs, like chocolate labs, yellow labs, black labs, and the silver labs. We already know silver labs aren't real, but that's a whole other topic. So they all, they literally eat. You think they won't eat it? Remote, I ate it. Bottle, I ate it. Rock, I ate it. You know what I mean? It's like,
swallow it whole. Listen.
Whole.
It will swallow a whole rabbit whole.
I know.
I don't know how they do that, but
hey, you know what I'm saying? But the point is, that's foreign body surgery or death, essentially. And surgery, I'm talking, depending on how ill the animal is, depending on the size of the animal, because medications and things like that, depending on where you go, it can be anywhere from $3,500 to $6,500. So, savings.
Easy. Which is, if you compare that to the human medicine, that is a nickel in the bucket. Okay.
Nickel, yes. Yeah.
Don't just look at anybody. Ask for anybody's bill for anything. Hang them.
Tylenol. $800.
Yes. Oh, that's $1,000.
Yes.
Okay. Easy. But yes, understanding those breeds, understanding that how certain color patterns and eye color patterns can affect certain characteristics of a dog. So as far as being blind, being deaf, they are cute dogs. Just know that down the road they could have certain issues that could arise.
Absolutely. The next one, do not lie and carry your medical records with you, especially if you're going to a new hospital.
Yes. So the biggest thing for me, I tell my owners is, listen, I'm not here to judge you or think any ill of you, right? So tell me the truth from the beginning. Okay, don't wait till the end and be like, by the way, a little piece of chocolate. Epic.
Exactly.
But, tell us that in the beginning, because we can cut out a lot of stuff if you just let us know. Exactly. You got into a little bit of cannabis.
Or maybe a lot of it. But the point is, he got into some.
Exactly. I don't know why he's so twitchy.
Right.
Okay. It's okay. It happens, right? Just be real up front so we can literally do our job efficiently, and then we can cut costs, because I know that. It's like, we can do some monitoring. You can go home maybe, figure out how bad it is, or induce vomiting, right?
It just helps us, it just puts us in a better position to be able to help your pet, right? And that's the most important thing. And obviously, if there is a cheaper way to go about helping your pet, because we have all the information we need, and we can, as Dr. Moore said, cut out some of those tests that we really don't need to run, then great. But if you're not gonna be honest with us, then yeah, we gotta do some things to get the answers that we need.
Yes, because if you come in saying just look, okay, let me get my X-ray goggles out.
Yeah.
See nothing. I saw nothing.
Not gonna happen.
So, honestly. we honestly rely on our diagnostics, our tests and tests, because our patients cannot talk to us, right? Exactly. And if we don't have all the full history together, you don't know what happened. Now we're really relying on diagnostics, physical exam, clinical signs,
right?
To determine the right path for your pet.
Right. Absolutely.
In every medication will come with a side effect. Okay, even the fish oils for joint supplements, to help with inflammation. If you eat too many, you could have some loose stools. You could have low vomiting for sensitive. Pain meds. We're not going to choose a medication that will be contraindicated for your pet. If I know your pet has liver values are elevated, kidney values are elevated, we're going to choose something else. So just keep that in mind, that people will say that we're in this for the money. Understand that if our pet is dead, we have no money.
We have no money.
It doesn't make sense.
But ultimately, that's actually a good one to talk about. We're in it for the money. That's definitely a good one. But I will say, ultimately, whenever we make recommendations, just please listen to us. So if we tell you to do a medication 3 times a day, don't do it once a day. And then call us asking why your pet isn't getting better. Because guess what? We're going to tell you to come back, right? If we tell you to abstain from, using the stairs excessively because your pet is dealing with some back issues and we're trying to, not have you have surgery, then don't have them chasing the ball up the stairs. Carry them. You know what I mean? Like, just listen to us. We know what we're saying. We're not gods. Nobody is, but we know what we're saying. And that's why you came to us. And that's why we have $400,000 worth of loans. So, you know what I'm saying?
Fraction of that. So.
Yeah. So, yeah. Yes. It's just in your pet's best interest.
Yes. Just to piggyback, like the e-collars, right? After any surgery, your dog's gonna be feeling great. They got the good drugs, okay? Yeah. And when we send you home with pain meds that are gonna be fantastic for them, and I say put the e-collar on, understand that 3 to 5 day period where the skin starts healing, gets a little itchy, your pet will literally chew out sutures, like chew them straight out through the skin, the subcutaneous muscle, all of that.
Yep.
In 5 seconds. So that e-collar keeps the wound clean, keeps the stitches in place, prevents evisceration, any organs coming out from just constantly messing with that, and prevents another visit from us. Yes, it's a long time. Yes, your dog is confused. They cannot hear well, but it is a short-term inconvenience.
Right. And that's a good point, because ultimately we know what's best for them. And so it's up to us as pet owners to make decisions that serve them well on their behalf, right? So they don't know why they got a gastropexy where their stomach was tacked against the body wall. They don't know why they had to have their testicles removed, but we do. So now it's like, now you have to heal. And I can't have you going after your skin, because that's gonna be trouble for everyone. So you gotta keep the e-collar on, and please just listen to us. So if we say, do not take it off, just leave it on.
Or say, do not stop this drug right away. Don't listen. We're saying that only.
Exactly. Oh my goodness.
Taper. If you want to stop it, give us a call. Say, hey, look, I'm ready to stop this medication. Okay, cool. Let's do a tapered schedule. We'll send you one, put a copy on this day. We'll have 3 weeks, and then we'll be done. Right? Yep.
Absolutely.
Just tell us what you want.
Exactly. Or if we prescribe antibiotics for a whole month, say because you have some skin issues, and you stop it at 2 weeks in, and we said, even when the skin starts to look better, please don't stop the medication, just keep going. But you say, I don't need to keep taking drugs. And then the skin flares up and you start calling like, I don't understand why. And then when we tell you, you got to come back in so we can see what's going on, you're like, well, I don't understand why I have to come back in. Yes. Like the reason if the issue is miscommunication, please ask for better understanding, because we can explain it to you. We can tell you, like, listen, we do not want to prevent
or cause resistant bacteria from forming.
Right.
We want to make sure that, yes, even though the clinical signs are gone, but the suboptimal levels, the amount of bacteria that's there that you cannot see is actually being treated as well.
Right, exactly. Just listen to us, please.
You pay us for that. You pay us for that.
Yes, exactly. Last but not least, actually, I think you touched upon it already, using that e-collar.
E-collar.
Ooh, man.
Yes.
Listen, it's like the cheapest thing you can do to save money. Like when I, for example, in the ER, whenever I have to do a laceration repair, let's just say a dog got attacked by something, comes in, I put in the sutures, I send them home in an e-collar. It's not because we don't want to torture you. We know that they're going to find uncomfortable, but guess what's going to be worse? Them reaching their wounds, as Dr. Moore said, chewing everything out, maybe even causing more damage. And then guess who's calling the phone at 11? Right? Oh, my dog's bleeding everywhere. Da, 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 da. Well, man, weren't you just here like 2 days ago? And so then I sent you home an e-collar? So how did this happen? Well, so you see what happened was, and it was like, I told you, it literally takes 2 seconds for them to be like, okay. They're little ninjas. They just move with stealth. And
yes. So their pain tolerance is not as high or low.
It's high. They have a high pain tolerance.
Yes, it's high. So it's not as low as ours are. So they will shoot through their skin. Okay, a little pain. I feel like it hurts a little bit, but we're getting the source of the problem. Okay.
Exactly. Or like for female dogs who get spayed and they're told keep the e-collar on, right? Yeah. Owners don't do that. So then they find their dog literally just hanging out, just chewing on the intestines. Like, what's up, mom? Right? Like, that's not okay.
It happens.
Oh my gosh.
It happens. And it's sad. It really is sad because something like as big as that could have been prevented by a simple thing.
Right.
The other thing with e-collars is if something happens over the weekend and you're like, I'm not going to pay ER prices. And you're like, okay, it's like a little skin rash. Put the e-collar on, because the worst thing that you could do is to let your pet continue to lick and scratch at it. It's not going to get that way. So e-collar, you can clean with soap and water. You can do a little clip if you got some clippers there just to kind of see what you're looking and dealing with. Right. And just do that method until you can get an appointment with your veterinarian.
Very good point. Yep. So we're about to save you guys some money this year, okay?
Yes. It'll help you. And it's just, like I said, generally increasing the efficiency and communication with your vet and yourself. Don't lie to us. Tell us what you want, okay? If you want to feed your dog a raw diet and I say don't do it or whatever the case may be, and you're like, in your head, I'm gonna do it anyway. So just tell me that.
Just tell me that.
All right, we're gonna switch our approach. We have balanceit.com to make sure you're getting anything. Make sure you have other options that's not Africa certified, but still a better option than you trying to mix it together yourself. Just tell us, look, I mean, honestly, it's your pet. You're gonna make the decision. We just want to be in the loop on that.
Right. So we can best guide you all. Okay.
Yes. Yes. Exactly.
Right. Well, thank you, guys. Thank you. So I think we did a really good job at covering 5 easy, very simple ways that you guys can, save some money this year. We are definitely going to be putting out more videos, more content. If you guys want to see something in particular, please let us know. I really hope this has helped you all in the meantime. Of course, we want you to laugh in the process. Pet ownership should be fun. It should be holistic and loving and feel good. So that's what we want.
Exactly.
All right. So thank you guys so much for watching.
Thank you.
We'll see you in the next video.
Bye.
Bye.